world can be confusing for a lot of people, especially when it comes to medication plans. Here to help us understand this issue this morning, as always on Wednesday, is Dr. Quinn. Good morning, doctor.
Good morning.
All right, so this is kind of an issue that a lot of people don't really think about. You know, we think about, oh, I've got something wrong with me, I need to go to the doctor and figure out what it is, but I guess a lot of times people forget about how to take their medication and how, I guess, that can lead to worse things if they don't take it. So you want to talk a little bit more about this issue this morning?
Right, and I just want to tell you about a scenario that's very unfortunate that occurs time after time. And basically, this scenario includes an individual such as an elderly person, which actually happened about a month ago. And that's what prompted me to do this story. I was talking to the lady, and she was like nodding her head like she understood what I was saying, but then at the end she asked me, you know, do I need to take any medication? And we went over everything. So I asked her what I always ask my elderly patients: do you have someone in your family that's familiar with medicine? And she said that her granddaughter that lived in Houston was an RN. I said, can we call her? And, you know, I documented her chart. She gives permission to give her medical information to the family member. So I called the young lady and put her on speakerphone and went back over everything. And then I asked the patient if it was okay if I emailed her the information, in which the young nurse in Houston said that would be great. So we emailed her the plan and gave it to the patient. And then the patient and her family, along with the nurse in Houston, went over the plan the following day at the patient's home, and they lined the medicine up. But the take home from all this is so important. If we have elderly people or people that might not have the best understanding of direction, let's get them a liaison to go to the doctor with them, and that way they can get the most out of the visit.
So getting family members involved is a good fix to that. Just repetition, it sounds like repetition is key, talking about how multiple times this is what you need to do about this is when you need to take this medicine. But are there any other ways, say someone doesn't have a family member that they can go to on a regular basis, are there any other tips and tricks that you have to help people with this issue?
Yes, if they don't have a family member, maybe someone in their church. Most churches have a health ministry, and I advise everyone out there, if you're an elderly person or you have elderly people in your family, try to find them a liaison to go to the doctor, which was a big problem with my grandparents before I went to medical school, because, you know, we were from a very small town of Macomb, and a lot of times they go to the doctor, they didn't get the information correctly, but when I got in med school, they used to, like, have me to talk to the doctor, and I could really help. But it's so helpful, and it's just phenomenal, the deficits that go on when patients don't understand their medicine. Like, I'll get a call from the emergency room with a patient that's taking the medicine 3 times a day, or maybe every week, and they're confused, and they might end up, if they already have heart failure, an exacerbation, and a hospitalization that's unnecessary could have been avoided. Or if they have diabetes and they're not taking their insulin correctly, kidney failure, untimely deaths, and so on and so on. That's why this is so important.
Right, and just to reemphasize what you said this morning about how finding that liaison, finding someone to go to the doctor with you, someone just kind of to keep you in line with, make sure that you're following that medication plan exactly, because as you talked about, some big impacts, some big health impacts can certainly come from taking that medication incorrectly. But we know from what you said this morning, it can all be avoided.